Microscopic lumbar discectomy. It's basically taking out a herniated disc in the lower back that's pushing on a nerve. It's probably the smallest, least invasive, best surgery we do. There's still risk with any surgery, but if you're not getting better, it's a very good option of what to do. So when do we decide to do the surgery? It depends on a lot of factors. Some of the main ones are how long has somebody had the pain, weakness, and numbness? How bad is the weakness? If somebody has a severe neurologic deficit like a foot drop or calf weakness or quad weakness, especially if it's an athlete affecting their job, we may do the surgery right away. If it's pain, we typically wait several weeks, between 4 and 12 weeks, to see, is this going to start to get better on its own? That's when we treat people with oral medications, physical therapy, acupuncture, chiropractor, epidural injections. All of those things are attempts to decrease the pain and inflammation, to buy us time to see, is this thing going to go away on its own and avoid surgery. If someone's not getting better, then it's reasonable to do the surgery. There's always a risk with any surgery, but this is the least invasive, most effective surgery, been proven all over the world. So how do we do the surgery? There's 2 different techniques that we utilize, and it depends on where the herniation is. If the herniation is the typical posterior lateral herniation in the canal, hitting the traversing nerve, for example, if the herniation is at L4, L5, the disc has 2 numbers. If it's hitting the L5 nerve, which just has 1 number, then we'll typically do the surgery from the midline, pull the muscle back, make a hole in the lamina, a laminotomy. We don't take out the whole lamina. It's not a laminectomy. Therefore, the arch is still preserved, and therefore the stability is still preserved. We work from the opposite side of the table in order to save the facet joint. We remove a hole in the ligamentum flavum, which allows us to see the nerve and to see the disc herniation. Then we take out the disc herniation lateral outside of where the nerve is. So typically we're able to take out the herniation without having to retract the nerve. Once the herniation is gone, we can safely retract the nerve to check for any other pieces or any other bulges. So it's the most common straightforward surgery, usually done as an outpatient. Probably 80-90% of our people go home the same day. The other type of surgery we do for the microscopic discectomy is if the herniation is in the foramen, out on the side, like this red thing sticking out here. So for instance, at L4, L5 again, if there's a disc herniation there that's hitting the L4 nerve, the upper nerve, the exiting nerve coming out the foramen, we want to save this facet joint. So we don't start in the midline and work out there because we want to save the joint. We actually come in at about a 30-degree angle with a tubular retractor, which starts with a small hole in the muscle, then dilates up with bigger tubes. We put the tube down, and then we use a microscope to go down, release the ligament, shave down the side here to get access to the disc, take the disc herniation out under the nerve there. Same recovery, same risk, same everything and most people go home the same day from that surgery. It's just a little different technique, and that's part of our practice is we really modify what do we think is the best technique for each individual condition. And those are the 2 different discectomies. The results are basically the same. There's obviously complications from any surgery. Microscopic lumbar discectomy is one of the safest surgeries done all over the world, but there's always a risk for bleeding, infection, spinal fluid leak, nerve damage, which can cause numbness, weakness, pain. A risk from an anesthetic is always stroke and heart attack and death, but those risks are very low. The overall outcome of the surgery is significantly better than the chance of having a complication. We published our results in professional athletes. I think we published about 70 professional athletes in just about every sport, and we found that 89% were able to make it back to their professional sport after the surgery. The average return to sports was about 4.5 months. About 50% of athletes were playing in their sport 3 months after the surgery if their season was in season. So that kind of gives you a range for most normal people. Typically, like I said, it's an outpatient surgery. Plan on taking 2 weeks off of your life when nothing's expected of you for 2 weeks. You're up and walking right away. Most people can work from home after 2 to 3 days. Most people say it felt like they got kicked in the back for about 3 to 5 days, and that's when you may take some pain medication or anti-inflammatories or muscle relaxants. I see people back 2 weeks after the surgery. Most people are not taking any pain medication at that time, and typically they're ready to drive and ready to go back to work for the most part. But it's a gradual recovery. The back of the disc and the whole neuromuscular control still has to heal and recover and stabilize, and that generally takes 4 to 8 weeks. So for the first 4 weeks, we just want people to walk, and we don't start our PT program yet. At 4 weeks after the surgery, we start our PT program. We want people to go to a physical therapist, chiropractor, or certified athletic trainer to learn the exercise, to do them properly. The whole program is in our app, the Back Doctor app. You start at level 1 and you work your way up. It usually takes people 2 to 4 weeks to get through each level. Depending on when you get to the next level, and if you're not having symptoms, is how we return you back to athletic activities and exercise activities. In general, when somebody gets to a level 2 of the program, of at least 3 of the exercises. When you're at level 2, you can do non-impact cardio, like elliptical, bike, swim. When you get to level 3, you can typically do axial loading, running, rotational exercises, sport-specific exercises for athletes, shoot, skate, run, swing, hit, that type of stuff. When you get to level 4, you can lift more serious weights and practice with your team. And we want professional athletes at a level 5 before they go back to their pro sport. And those are tough exercises. So if we can help you in any way, please email us at info@watkinsspine.com. Or if you want to come in for an appointment, please call 310-448-7890.